Good morning and welcome to a sunny, cloudy Johannesburg. Welcome also to my Solaris channel, where today we will be discussing psychotherapy and how it influences a person's life. Psychotherapy is basically a talk therapy where different techniques are used to resolve issues that is troubling a person. It makes them feel better mentally, physically, and emotionally. Psychotherapy appeals to the mind of a person to create positive thinking and perception. In my case, my negative perception and thinking was making me sick overall. Psychotherapy requires a person to be totally honest about what is troubling them. Honesty is a crucial factor because if you as a person do not identify what is troubling you, you're not going to get the desired result.
So cooperation is vital.
Yes, honest cooperation is key to finding a solution to what is troubling a person. But psychotherapy would possibly not work so well where there's a severe chemical imbalance in the brain of the person.
Because that's a physical ailment?
Yes, I would say so. Where the chemicals in the brain are imbalanced to such a severity that the person, no matter what technique you try and use to resolve issues, it might not work.
And that would be treated with medicine?
It would be treated with purely medicine, maybe for a lifetime, I would say. And fortunately for me, I had reactive depression. And I was honest in telling the therapist exactly what was troubling me. And at the end of the therapy, that was after 2 years, we did find a breakthrough. So back to the issue.
Is that when you found your stimulus?
Exactly, yes. It's during therapy you find the stimulus to what is causing reactive depression. In therapy...
that's the part you spoke about in yesterday's video, right?
Yes. But it ties in with yesterday's video because psychotherapy was the technique or the tool where I found what was my stimulus. For me, I would say it's an indispensable tool in a person's life to improve and to create peace and happiness within oneself.
What is the difference between a psychiatrist and a
psychologist?
Yes.
A psychiatrist administers medication to the patient together with psychotherapy, whereas a psychologist uses techniques and tools to reverse what is causing the problem.
Does that tie in with what you were saying earlier about severe cases where there's a chemical imbalance? They would prefer to probably be better off seeing a psychiatrist than a psychologist.
Exactly, yes. Because the psychiatrist would prescribe medication, and depending on the severity of the sufferer's condition, the chemicals that are released by the medication can make the person feel better to an extent, but it doesn't take away symptoms totally, like suicidal thoughts and in severe cases. And basically the person would be placed under the care of a psychiatrist in such instances.
So in your case, it would be more of a case of a psychological condition rather than as opposed to a medical condition.
No, in my case, it's the reactive depression was a chemical imbalance. The stimulus was causing a chemical imbalance in my brain, and I needed therapy to remedy that situation where the stimulus was causing chemical imbalance. So together with medication, the psychotherapy worked very well.
In combination.
In combination, yes. For me, I would say that psychotherapy is an indispensable tool in any person's life, and it can improve one's life and create peace and happiness, which we all desire. And it's an immense tool that improves a person's life. So I would like to say to people out there that there is hope. Please do not give up on your life. Try medication, give it a chance. It takes a minimum of 2 years to work. Psychotherapy is an intensive process as well. It takes a minimum of 2 years to work. So I would like to end the topic there for now. I'm sure we'll revisit psychotherapy at a later time. So if you could please like, subscribe, and ring the bell. And if you'd like to contact me, I would repeat my email address. It's solarisgarden69@gmail.com. Until tomorrow,